Thank you for staying with us. My name is Migwi. You are watching Good Morning Kenya. And because it's a Tuesday, you know, this is Health Tuesday. And we are talking about aesthetic medicine. What is it? Because we are living in a world where everybody wants to live a fulfilling life, be in good health, and still minimize the effects of natural aging. And to help me in this conversation about aesthetic medicine is none other than Dr. Arshni Malde, who is an aesthetic doctor and also MD at Tia Clinics. Karibu sana.
Thank you so much.
How are you doing today?
I'm doing great.
Yes.
Yes.
Now, let's get into the whole idea of aesthetic medicine. What is it?
So aesthetics is all about looking good. And I say to my patients, it's about you looking good in your best skin without makeup. So of course, makeup enhances you, and will make you look more beautiful, especially for women. But even for men, you just want to look good, be it hair, be it skin, be it your weight, be it your body, anything. And so we have advancements now, and we do procedures where we help you to get your desirable skin, hair, and body. Yeah.
Speaking of procedures, do some of these procedures within aesthetic medicine require anesthesia?
What I do personally only requires local anesthesia, which means it's localized. So for example, we're doing a facelift, we only do anesthesia on the face. If we're doing a hair transplant, we're only doing anesthesia in the head. And it's local, just like how you'd go to the dentist and have local anesthesia. It doesn't involve general anesthesia. Yeah.
Speaking of that, still on the aspect of aesthetic medicine, what are the trends currently, both globally and within the country?
So when we talk about hair, of course, hair transplants, it's a very big thing. We also do regenerative medicine, which is known as growth factor concentrate, which is more a maintenance procedure. When it comes to skin, we generally major in non-surgical facelifts. You must have heard of Botox, fillers, such a big thing now. We also do general treatments like treatments for acne, treatments for open pores. So smaller procedures as well, but this is majorly it. You want your skin to be looking flawless. There's this trend of glass skin, and so everybody feels like their skin should look like glass, and so that's what we do to enhance your skin.
Let's talk about hair. How is that procedure like? Because we are talking about people who are losing hair or they are already bald. What is that procedure like?
So it's generally a hair transplant when you're already bald, because there's nothing else we can do. It's like a barren land. You don't have roots, or you don't have seeds. And so when we do a hair transplant, we remove hair from the back of your head and replant it in the front of your head. And that's generally done from your own hair. So basically it's a natural process, which means we're removing your own hair and replanting your own hair. Doesn't mean we're making you bald at the back, of course, but we're just removing hair from the back and replanting in the front in the area of baldness.
And that hair will grow normally?
Yes, it will.
Wow. Now, how can one understand their type of hair to make sure that they take good care of it and avoid chances of damage or hair loss?
Well, generally, there's no particular indication for particular hair type. All hair needs to be taken care of the same way. A lot of things that need to be done at home, for example, it's very necessary to use a medicated shampoo once a week. These are things we don't know. It's necessary to hydrate the hair in form of oiling the hair once a week. And then, of course, just taking general care of the hair, keeping it clean, which we all try to do. So these are the basic things that you can do at home to prevent hair loss. We then have supplements, of course, so you can go that way as well. And as I spoke about GFC, regenerative medicine, that's more a maintenance treatment. So, for example, you're not yet balded, and you want to do some maintenance treatment so you prevent the balding. That's where we step in now.
Let's say I've gone through a hair transplant. Of course, there are maintenance procedures I have to undertake. But are there chances that there will be a relapse of that hair where I get to go bald again?
Well, we guarantee you about 20 years of hair. Of course, hair and skin is constantly aging. So when we say 20 years, it doesn't mean 20 years exact. You could have a different lifestyle, I could have a different lifestyle, and all those things matter. But otherwise, yes, the balding can start again after 20 years. So it doesn't mean all the hair is just going to shed off in one go. It will slowly start balding again.
Talk about the major causes of hair loss. Of course, we understand alopecia is one of the conditions that lead to total hair loss.
So it's standardly alopecia. They're just different types of alopecia.
Talk about them.
Yes. So we have the main one, which is androgenetic alopecia, which is the real balding now, which happens in males and females, of course, with age. But I wouldn't say age is a factor these days, because we see even as young as 18-year-olds completely bald. And so it's more lifestyle, stress levels, food habits. We're so full of junk food these days. So all these things contribute to hair fall. We then have traction alopecia, which is the most common in Africa because of the traction from the braiding and the weaving. And so you will see females generally suffer from traction alopecia, which means they bald in band way. So it's just a band of hair. And so that's another type of balding. There's alopecia areata, which is more immune, which means you see patches of hair loss, and it's random patches, but that can also self-heal. We have alopecia totalis, which means no hair in one particular area or a few particular areas. So you might just not have hair on the whole head. And then there's alopecia universalis, which is no hair, full body, head to toe. So we don't have treatments for universalis, but we have treatments for the rest of them.
When you say no hair, full body, that includes the eyebrows, the...
Yes, you're shiny, head to toe.
There's also the aspect of scalp infection. What infections are we looking at in this aspect?
Majorly fungal infections, but of course we have infections, or you can say there's things like dermatitis, psoriasis, eczema, and so these also contribute, but I wouldn't say they contribute severely to any kind of alopecia. You'll just have a very inflamed scalp, and is why I mentioned initially it's so necessary to use medicated shampoos and at least do that once a week, because that allows to heal the scalp. Often so when we're doing the hair transplant, we see scalps are so infected, and the infection is not just on the top, it's all the way under the skin. And so we find it really hard to even get hair because it just breaks before we even pluck it out. And it's just lifestyle. It's also, I mean, I don't mean to downgrade, but it's also, you know, people going to salons, and then also culture, because what happens is back in the day, women wouldn't even wash their hair maybe once a month. And so there's so much of build-up with pollution, with sweating, the wigs itself not being washed. So we're trying to raise awareness and educate the crowd that we can't stop culture. We can't just, you know, say, don't do this. But we're just trying to educate you on how to prevent and how to maintain and how to have a healthy scalp. And so medicated shampoo is one of the best ways to do it, to start off with. Yeah.
There are also cases where there is hereditary hair loss, such that I inherited from my parents. But how do we remedy that and ensure that we prevent this hereditary hair loss?
So that used to be factor number one for androgenetic alopecia. We used to say you only bald because your parents are bald, either your father or your mother, whatever. But it's no more the concern. You'll see like you're completely bald, for example, but your father still has a head full of hair. So genes don't play such a big role anymore. It's more lifestyle, more food habits, and just stress levels. Our stress levels are so high. But same thing, maintenance is key. So if you know that you're at the start of balding, you can always take care of it. Supplement yourself, do some treatments like the growth factor concentrate. Or else, if you've not yet started balding, then just ensure you're doing the basics, oiling your hair, keeping it clean, medicated shampoos. That's core and key to healthy hair.
And now, about aesthetic medicine now. Are there myths or cultural and ethical aspects or concerns that surround it?
Very few, but yes, they're there. When we started initially, people would ask us, can you get a brain tumor out of hair transplants? Can you get cancer out of lasers? So studies show that that doesn't happen. And of course, so much of clinical trials. It's such an advancement in the Western world. So we are ensuring that these things don't happen. But yes, sometimes ethically we see patients coming in to say, no, you can't remove my skin tag, or you can't remove this on my skin because it represents my family. But or otherwise, we just see people saying, disputing that, no, you look good the way you are. You are the way God made you, so why do you want to change that? But it's advancing now, so it's an easy road. Yeah.
Is it different or is it the same as plastic surgery?
Very different. Everything we do is non-surgical, and so we're trying to be non-invasive. It's, of course, probably the same results. Maybe plastic surgery has better results. It really depends on the indication and what you want as the outcome. But everything we do is completely non-surgical and non-invasive.
And also, is it different from dermatology?
Absolutely. We don't treat skin diseases. So all we're doing is just beautifying you. Yeah.
Now, repairing damaged hair is one of the things that people especially grapple with. Besides using shampoo, are there other procedures that people can use to ensure that they have perfect, good and full hair?
Yes, the growth factor concentrate is amazing. We're a pioneer in Kenya for it. And it's basically your own blood, 100% growth factors. And growth factors means growth. So it's enhancing new follicles, so giving you healthy hair. And then we generally supplement with biotin, which is vitamin B7, which thickens the hair. We also supplement with minoxidil, which stops hair fall. So it runs like a cycle. When you have new hair, you want to thicken the new hair, and then you want to stop it from falling off. So that cycle works really well to have really good, healthy, long hair. And otherwise, I always push my patients to hydrate their hair in form of oiling. So oiling is absolutely essential, and be it anybody, oiling is necessary.
But not just any oiling, with any oil. Are there specifics that that people need to use if at all we are talking about oiling?
Believe you me, any oil is good. Whether you have coconut oil or castor oil or Jamaican castor oil or onion oil, there's so much out there in the market. And anything works well. We've advanced and tried to combine all the oils. We try to put in some herbs which help hair growth. So, of course, a combination would be better, but it really depends on what your preference is, what you can afford. So you can just walk into a supermarket and pick up just a normal coconut oil, which is perfectly fine. Yeah.
Let's say a person has come and gotten a hair transplant. How long does it take for the healing to complete and now the hair can go back to normal?
10 days. The healing takes about 7 days. But we have something called scabs, so it's evident that you've done something. And so we do a hair wash on the 10th day, and now you look completely normal, and you can walk around. But I think people have really embraced it. So ideally it's a 2-day procedure, and then on the 3rd day you're completely fine. There's no bleeding, there's no dressing, there's nothing. So you can literally walk around even on the 3rd day. And so 10 days, you look normal. For the hair to grow, it takes 1 year. And after 1 year is when you'll have a full 100% results. And now that is the 20 years we promise from there on.
Yes. What are the do's and don'ts within this healing period now that you have done the hair transplant?
So it's a tough game for women because we stop them from using the wigs and weaves for the first 6 months. So they really have to be mentally prepared to, first of all, be shaved off because we have to shave you off completely. Even smaller hair than what you have right now. It's basically a zero cut. And so women have to walk around that way. We only advise them to do maybe scarves or ketenges, which they can tie up nicely, but no wigs, no weaves, no caps, no hats. So the first 6 months are very crucial.
Yes.
Yeah.
So to understand this hair transplant aspect, if I'm doing a hair transplant, I have to be shaved all round, or it's the area within which I want the hair to be replaced that I'll be shaved?
It's better to be shaved all round because we have to shave you at the back because we only need the root, which is under your skin, and our machine is literally this small. Otherwise, we need to be shaved at the front or where you're balded. So you could be balded here, or you could be balded in the front. And so there's no point of leaving some hair in the middle because it's going to look really funny. So we push patients to just shave it all off, and so it can also grow together and look more natural.
Yeah.
And otherwise, sometimes the choice of females where we just leave a band of hair so that they can go back and weave it later or put some extensions to it.
Is there a demographic that you can say is gravitating more towards aesthetic medicine today?
Yes, of course. Everybody's so aware of aesthetics. Definitely the Western world, the Eastern world, also let's say up north, even West Africa, they're crazy about aesthetics. So we're slowly getting there. And definitely when I started in 2020 in Kenya, it was a bit of a rough road because people wouldn't understand what is aesthetics. But now the awareness and education is so high. Patients know what they want. Patients are so alert. They already know how the procedure is done. So it definitely helps us as well because it's less education and just more of results. Yeah.
Let's look at the interplay between aesthetic medicine and skincare. How, of course, there are different types of skins, but how can one determine the kind of the type of skin that they have?
It's really visual. There's so much out there in terms of skin analysis machine and all these things, but it's person to person, and it's very evident when I look at you visually because I can be able to tell you have hyperpigmentation, you have melasma, you have wrinkles, you have open pores, you have dry skin. But also, like I said, patients really know their skin type. So they're very confident in, okay, this is what I want because I want to reduce my pores, I want to get rid of my wrinkles, I want to tighten my face because I'm sagging. So everybody knows what their skin type is. When it comes to skin color, that's what we specialize in. It's skin of color. And so, of course, initially treatments in aesthetics were only made for fairer skin. And we had to advance ourselves and, of course, also do a lot of research on skin of color because, for example, some lasers don't work on darker skin. So you have to be sure of what you're doing in terms of treatment and not damage the skin further because we're treating a problem. We don't want to bring another problem to the problem. Yeah.
But let's say I have a tattoo on my arm and I want to take it out. What are the procedures?
It's generally laser tattoo removal, but I personally am not a big fan of it. It doesn't remove the tattoo 100%. I have never seen any machine in my practice that does that. And so often, when I get patients who come in with a tattoo, I definitely explain to them the procedure. It's ink, which is very deep into your skin. And what is the laser going to do? The laser is only going to shoot the ink and blast it off into smaller particles, but there's no way those particles can get into your bloodstream and come out of your body. So it will only disperse your tattoo, make it lighter perhaps because the ink particles are now much smaller, but it can never get you back to the same skin you always had. And so we do tell our patients that we could give you about 70% result, but it's still going to be evident that you had something there. And the best bet I give to them is, look, just go back to your tattoo artist and tell him to do you another tattoo on top of it. It actually works better.
But still, is there a downside or a side effect to tattoo removal? Because here we are talking about skin care. Is there a downside to it?
Definitely. There is downtime, which means that when we do the laser, the skin is going to dry up, start peeling off, and so you have to do multiple sessions, which don't happen so often. So it could be a series of 3 months, 6 months until you get that 70% result. Also, we know that darker skin types are very prone to keloids. So if you're prone to keloids, you have keloidal skin, you can end up having a keloid. So if not taken care of in the right way, you'll have a dispersed tattoo and then also have keloids on top of it, and it's now just a longer journey to restore it back to square one. Yeah.
Now, dry skin. There are degrees to dryness of the skin. Talk about the levels of dry skin.
Okay, so dry skin, I would say, well, everybody has dry skin. Even in terms of when people come in saying they have very oily skin, there's still skin that gets dead and dry. And so core maintenance for skin is cleansing, exfoliating, and hydrating the skin. If you're hydrating your skin enough, no matter the kind of dry skin you would have, it definitely helps you to have good, neutral skin.
What are the benefits of aesthetic medicine? From a general perspective, what are the benefits of aesthetic medicine?
Okay, so back in the day, we all just used to use Vaseline, and we were so comfortable. But now we have the advancements. Somebody might be concerned about their wrinkles, somebody might be concerned about sagging skin. So these are the benefits because we have the treatments for it. But all in all, even if you may not be concerned, when you do aesthetic procedures, we just enhance the way you look. And we enhance the way, technically you'll just have better skin. So benefit is always consider doing something. You may not know that you're suffering from hyperpigmentation. You may not know that you have oily skin. But when you actually get treated for it, you'll be able to appreciate that, oh yeah, this actually looks better than how I used to look before. Yeah.
Now, in this procedure, people with medical conditions, let's say autoimmune diseases, are they eligible to go through these procedures? And if so, are there side effects that will either exacerbate their conditions?
Any disease is not a hindrance to us at all. We treat everybody. And so, yes, we have to take our precautions, of course, but there's no stopping you from doing a treatment because you're suffering from something else. In fact, one of our treatments, which is the antioxidant therapy, really boosts your immune system. So it's actually making your body much better. And so everybody's welcome to us. Yeah.
Let's talk about the services within the skincare. There's the aspect of Botox and also facelifts. Talk about both and also give the benefits and downsides to each.
Okay, so Botox, to start off with, Botox is to get rid of your wrinkles. And so Botox is majorly done upper face and the neck. And otherwise, the non-surgical, well, I'll only speak about non-surgical facelifts. Non-surgical facelifts are basically inducing collagen in your skin. Collagen is the elasticity of your skin, and so we just want to help you tighten your skin. So maybe you can raise your eyebrows and we can see you have some wrinkles. So you'd be an ideal candidate for Botox. Sorry, it's my job, so I've already identified it. And so Botox takes care of the wrinkles completely. Downside is if you go to somebody who does not know how to do Botox, then you're going to come back botched. So always ensure you're seeking a professional and you're doing something from somebody professional. Because you get just very basic example. There's something called brow ptosis, which means your one eye can look lower than the other eye if Botox done wrong. So it'll be looking like you're constantly winking at someone. And you don't want that.
But how do you determine that this professional that I'm going to knows exactly what they are doing?
I think all professionals know what they're doing because they're very well trained.
There is an aspect of quacks.
Exactly.
They want to make a quick shilling and go. How do you determine that this person knows their craft?
Most medical doctors are medically trained, but we do know of places, I don't want to specify, but we do know of places where you don't have medically trained personnel to do these things. They've probably just watched YouTube videos and think they can do it. So just be sure of where you're going.
Yes. Yeah. How long will it take for me to see the results if I go the Botox way?
7 days. In 7 days, you're wrinkle-free, and it lasts 8 months.
Oh, but 8 months.
Yes. And if it goes wrong, it still lasts 8 months. So you're going to be winking for 8 months.
Let's see. The winking part is a little bit funny, but let me ask. Now, a person who has undergone Botox and it goes wrong has to wait for, does it mean he or she has to wait for 8 months for it to be corrected?
Yes, there's no retrograde, so you can't do anything to reverse it. There are medicines, but they don't reverse it 100%. And so you will have to wait for at least 6 months to 8 months for it to go back to normal.
All right, we are going to take a very short break, but when we come back, we are going to talk about the aspect of facelifts, what they are all about and how they are done. We understand it perfectly, but we'll do that after this short break. Don't go too far. Welcome back to Good Morning Kenya. We do apologize for that technical hitch. Now, we are talking about aesthetic medicine with Dr. Arshni Malde here on Good Morning Kenya. And tumefikia Botox. Is there a downside to Botox?
As I said, just having done botched procedures. So something can go wrong. And now that's irreversible for about 8 months. There's no retrograde, so there's nothing that can rectify it until now the muscle unfreezes itself.
Wow.
But apart from that, no. Botox is a really good procedure, can really enhance your features.
Yes. Yeah. Now, let's talk about facelifts. What is it and what does it involve?
So there are different types of facelifts. I'll only speak about the surgical and the non-surgical facelifts. And I'll only, again, emphasize on the non-surgical facelift because that's what I do. But it really depends on patient to patient, also on indications in terms of how much sagging there is on the face, whether you're an ideal candidate for a non-surgical facelift or not. But what it basically does is it enhances your collagen, and collagen is the elasticity of your skin. That's what keeps your skin tight. And so when we do a non-surgical facelift, we're only enhancing collagen and, of course, now reducing all the sagging on the face. Yeah.
Is it permanent?
No, it's not. I did mention earlier, hair and skin is something that's constantly aging. So nothing will stay permanent on your skin, nothing will stay permanent on your hair. Your body is constantly aging anyway, no matter how much you maintain. So some of these procedures last a few months, some of them last a few years, but it's always good to maintain. you will have to come back for treatments again and again. And so when we talk about the non-surgical facelift, it lasts 3 years, and now you can come back to us after 3 years to have it done again.
Before considering a facelift, are there things that a person must first consider before going for that non-invasive procedure?
No, a facelift is the best thing you can do. It's only enhancing your collagen. There's no age limit. You can be as young. Well, I don't treat anybody under the age of 20.
Whoa.
But you can be 25 and want to do a facelift. It's not lifting completely. It will only lift you as much as you're supposed to be lifted. So if you have minimal sagging, it will enhance it. If you have severe sagging, it's going to tighten it completely. So it's ideally really good to have a facelift done.
So in other words, a person who is like 70 years can still get a facelift and look normal?
Absolutely. That's the best thing about facelifts. Nothing can ever go wrong with a facelift because we're only putting in something called threads, which is suture material, which only enhances your collagen. The threads dissolve in the skin after 2 to 3 months, and so nothing can really go wrong with the facelift. Yeah.
So meaning there are no side effects at all?
Nothing at all.
Wow. The whole aspect of aesthetic medicine must also come with a price tag. How is that? How does that impact the person in terms of money?
It's definitely a tear in the pocket. But, well, if you want a Land Cruiser, you're going to pay for it. And so when it comes to aesthetics, we do have some procedures which are quite pocket-friendly and can still give you good skin. But when we're talking, say, facelift, Botox, fillers, then you're definitely paying quite a bit. I'll just give a price range so everybody's aware of, you know, what they can be spending. You can spend as low as 10,000 in our facility and go up to 500,000 for a procedure.
That is a very serious procedure. It's costing $500,000
Absolutely.
Shillings.
Yes.
Now, how does aesthetic medicine interact with weight loss? Because everybody wants to look good, yes, and still maintain that healthy weight within their body. What is the interplay between the two?
So exactly what you said. Everybody wants to look good and maintain their weight. And so you don't just want to look good on your face. You don't want to look good with your hair. You also want to have a good body. And so weight loss is part of aesthetics. Again, when we said we're non-invasive, we do non-invasive weight loss treatments, extremely successful. We're looking at patients losing 15 kilos in about 3 months. And the best bit about our weight loss program is you don't have to diet. So you can go enjoy your chips, enjoy your chapatis, and still lose weight.
What are these procedures are we talking about?
It's basically a weekly injection, which curbs your hunger. So you'll only get into portion control, which means if you're eating 4 chapatis in a day or a meal, you'll go down to 1. And so automatically, because you have portion control, you're going to lose weight. Number 1. Number 2, it's a peptide, which means that it's a building block for amino acids, which is the core for muscle building, and that enhances fat loss and now promotes muscle building at the same time. So you won't have saggy skin, you'll have lost your fat, and you'll have built muscle in return. When I say built muscle, doesn't mean you become buff like a bodybuilder, but at least it's helping you build. You don't have muscle deterioration when you're going through weight loss. Yeah.
So can you go through these procedures that you're talking about and still go to a gym? Let's say, for instance, I want to build my biceps. I come to your facility. Am I still going to the gym?
Yes. Whatever you do in combination always has a synergistic effect. And so if you will be able to diet, you will have better results. If you will be able to go to the gym, you'll have definitely better results. The only thing I said when I said you don't need to diet is we're so social these days. And so sometimes, you know, people can't diet, don't want to diet. It's traumatizing to diet as well. So if you don't diet, it's okay. If you do diet, you have enhanced results. If you go to the gym, you have enhanced results. Yes.
So what about those balloons that people swallow for weight loss?
There's a hindrance there because you have to diet when you do the balloon. And so you cut off your carbs, you cut off your sugar, you cut off your milk, you cut off your alcohol. And like I said, we're so social these days. Our lifestyles involve us to be so social. And you don't want to stop on most of these things because it's really hard. So with our treatment, you don't need to do any of that. You don't have to traumatize yourself.
Yeah. So you don't have to diet. That is one of the things that people are not do not really adhere to, because of course you will have cheat days, and that will link back to, you will add calories that you want to shed, but still you want to lose weight. What other areas of skincare and hair loss do you specialize in? Are there other areas that you have that one may consider?
Well, hair care, no. I've basically spoken about everything. Our maintenance treatment is the growth factor concentrate, and otherwise we specialize in hair transplants. When it comes to skin, I can, you know, put a light on minimal procedures like if you're bothered about a skin tag, bothered about some moles on your face, what we call kidondas, we remove those non-surgically, and we don't leave you with a scar. We also do keloid treatment, so we know that a lot of people are prone to keloids. We also do scar removal, which is scars from anything. It could be trauma, surgery, C-section scars from post-pregnancy. So we deal with all types of scars. We deliver about 70% results, which is good. We also treat stretch marks, striae. Striae is such a big concern these days. They look like stretch marks, but way bigger. It's actually because of abuse of the steroids that people use. And there's so much of steroid out there in the market that is known as bleaching agents. And so you end up having striae, majorly on the hands, on the legs, and so we do the treatment for that as well. Yeah.
There are people who are into skin lightening. Is that part of aesthetic medicine?
Absolutely. That's one of the major things in aesthetics, but we don't do skin lightening, we only do skin brightening. And
what's the difference between the two?
Lightening is becoming white. And we don't promise that. When we say brightening, we're only bringing you back to your original skin color, which is generally at your chest or your bicep. And so we're only bringing you back to one color, only because you're often hyperpigmented, majorly the face and the hands, or exposed areas of the body. And some people suffer from melasma, which is such a big concern these days. Melasma is the hyperpigmentation on the face.
Yes.
So we only brighten you to bring you back to one color, one body tone. The whitening and the lightening is temporary. There's so many people who offer it out there, but don't tell their patients that in 6 months you're going to come back looking the way you were on day one. And so when it comes to brightening, we're ensuring you at least 4 to 5 years of even skin tone.
Wow.
Yes.
Well, as we close this show, what is your parting shot?
My name's Dr. Arshni, as I mentioned. We're based in Muthaiga. I have a clinic called Tia Clinics.
Yes.
And you can get in touch with us on 0799 995716. As I said, we do everything aesthetics. We also have a small spa there, so we do some luxury, I wouldn't say treatments, but things like massage, manicures, pedicures. So it's more of a lifestyle facility than just a hospital.
Yes.
And yes, of course, any concerns with hair, skin, I'm here.
All right. Thank you for gracing Good Morning Kenya.
Thank you too.
That is Dr. Arshni Malde, who is an aesthetic doctor and MD at Tia Clinics. This is where we cap matters Good Morning Kenya, especially this topic of aesthetic medicine. Thank you for tuning in. to Good Morning Kenya on behalf of my colleagues, that is Ray Manyara and Victor Law. It's a goodbye from me. Let's do this again tomorrow morning. Good morning.